From the Asian Community Development Council, this is Family in Focus, Mondays at 12 noon on PHLV Radio.
Good afternoon, everyone. My name is Petrania Poonswan, hostess of Family in Focus, brought to you by ACDC, the Asian Development Council, featuring topics affecting the Asian American Pacific Islander community. And obviously, this topic we're talking about today, COVID-19, the latest update, affects everyone. And we just want to kind of keep people up to date on what's happening, especially the resources that are out there to get people vaccinated. As you know, we've been talking about the COVID-19 vaccination clinics that ACDC has been putting together every weekend now for the last few months, and they're continuing to do so. So we're going to keep you updated on that resource. But it's so important to talk about this issue because COVID-19 is still here. I mean, Vegas has reopened up to a point, but it is still a danger. It's still a public health concern, and we want people to get vaccinated if they haven't. So today, I'm very excited to have our guest with us, Dr. Mandal. He's the Associate Professor of Roseman University of Health Sciences, College of Pharmacy. He is joining us here today. He's been on the PHLV radio before, talking about the importance of getting vaccinated and what's happening right now. Dr. Mandal, thank you so much for being on the show with us today.
Thank you, Patricia, and thank you, Johan. It's good to be once again with PHLV Radio. It's my pleasure to talk about the COVID-19 and current vaccines and a little bit of upswing in the new variant strain, that is Delta plus 2 variant strain that is already in the valley, in the country, what we can do, how we can protect the community, and together how we can get off the pandemic.
And we're so grateful to have you, especially with your help and resources. I know Volunteers with Roseman has been coming to the ACDC's COVID-19 vaccination clinic almost every weekend to help out with this process. So it's great to have them do that. But first, Dr. Mandal, I think you touch on it a little bit. I think the big concern with people right now is to get vaccinated. We're still not 100% in this country, right? And that's your goal right now. And I think with health officials across the country so what's happening? People are still, and I've heard, and this is what's kind of disturbing to me, is that the people go and get their first shot and they don't get their second one. You know, like so what's going on? Tell us kind of the latest on that.
So let's first, that's a very good point to begin our discussion this afternoon. First, take a look at the big picture, what's happening. As of right now, about 46% of the total US population got their vaccines. Either it's a two-shot Moderna or Pfizer vaccine, or it's a single-dose vaccine from J&J. In the Clark County, numbers are a little better, about 48% of the eligible individuals, 12-year-old and above, they got their vaccination. Mm-hmm. With that information, let's consider what's happening nationwide in terms of COVID-19 infection. Overall, the infection is down. That is true. But the concern right now is the emergence of these variants. There are two variants currently, fast moving throughout the country, including Clark County. The first variant that is causing concern is called Alpha variant, originally originated in UK last year, but already in US and many parts of the world. That is the largest new infection-causing variant currently spreading throughout the country, including Clark County. Little more dangerous is the Delta or Delta Plus variant, originated in India. Now, many parts of the world, it has been spread, including the Clark County. If I'm not too wrong about the data, there are about 20 individuals currently infected with Delta Plus variant, and about 900 individuals are infected with the Alpha variant. So the bottom line is that although a substantial number of individuals, like 48%, got their vaccines, but with the emergence of these variants, it becomes very, very important and necessary that we keep up our rate of immunization. We make sure that everybody who is eligible can and should attempt to get their vaccines so that we can defeat the spread of these variants. That is our current goal, and it is very, very important right now.
And I think the question people have is that, if I'm I'm fully vaccinated,
right,
and this variant that comes about, then that protects me, right? Even though I was, vaccinated months ago, but with this new variant coming in, it helps if you're vaccinated.
Right? Yeah, let me comment on that. It's a very good point that you raised. So what these 3 vaccines that we have in US right now, released middle of January onward, first Moderna, then Pfizer, then J&J vaccine. These all 3 are very good vaccines. They are clinical data and data on ground, meaning real world data. That's the key name, meaning after getting immunized with these vaccines,
right,
are these vaccinated individuals being protected? The answer is very clear and very, very encouraging, meaning it has been found through clinical research and tracking and monitoring of the vaccinated individuals that if one got their complete vaccination, they are protected at this point at least 6 through 9 months. Now, the question is what that protection means. That protection means most likely they would not get infected. Even with these new variants, one get infection, their infection will be very, very mild, not severe.
Right.
They will not need to go to the hospital, and most likely they will not lose their life. And these 2 variants, particularly Delta Plus variant, it's more lethal, more infective, more sticky compared to the original virus, COVID-19, that started spreading as of last year, causing the pandemic. Although the vaccines were developed on the original virus strain, yet this variant-specific immune protection is very high against those vaccinated individuals. So if one got their vaccines, they are highly protected against these variants, but unvaccinated individuals remains very vulnerable against infection, seriously becoming ill and hospitalized.
And that's the reason, Dr. Mandal, we're having this conversation today.
Right.
I mean, partly to get your expertise on what's the latest on COVID-19 right now, but also to remind people that right here in Southern Nevada, it's so easy to get your vaccinations, right? It's everywhere, including, and we want to show some pictures here. If you haven't heard, we've been putting it out there that the Asian Community Development Council has been offering this COVID-19 vaccine clinic. And you're seeing a picture here of actually one of our staff's daughters. She's 15, and they've been now, and I think you can go into it a little bit, 12 and over is safe.
12 and over, we can safely get the vaccines. And thanks for putting up that wonderful shot showing that a 15-year-old is getting vaccinated. And that's the encouragement. That's what we want to encourage, that these are very safe vaccines and this will save people's life. Because as things opened up, I was listening to the NPR that in the month of May, Macron airport, our airport, has received about large number of 6 million visitors. So that means people are coming into the valley, attending the conferences, attending the musical concerts, having a good time. We want them. But at the same time, we want to offer them a very safe environment because we are the host.
Yeah.
If we keep up with the immunization, if we can immunize few more individuals, then we will provide our guests a safe environment where they can come in and they can enjoy some time, and that will go to our benefit, improving our economy, improve our community members. And we can also participate in that little bit out of the COVID-19 pandemic era and slowly going back to the normal situation, normalcy. But the key is to increase the vaccination. As you said, that not only SCDC is doing a great job. I have worked with SCDC in the Shanghai Plaza, immunizing individuals. They are doing a great job. It's freely available. Along with SCDC, almost everywhere individuals can go to a drugstore, Sam's Club, Costco. Everybody is offering immunization. Nothing needed to be disclosed, only their date of birth and whether they have received the vaccine yet or not.
And I want you to pick this, we brought this up earlier, the fact that, there are a number of people, and this is not just in Nevada, but across the country, who went and got their first shot, but never bothered to go and set their second one. And you said even if they pass the time which they were scheduled, they can still do that anytime,
yes,
correct?
Absolutely right. Sure. Even someone missed their second shot at the end of third week or fourth week for Moderna or J&J vaccines, they still should go to get their booster doses, second shot, whenever they can, because there are some clinical studies that shows that even people's vaccination will differ up to 8 weeks, through 9 weeks or 12 weeks after the first dose. Not only they generated immunity, but some way their immune response is actually a little bit higher compared to the individuals who got their shots within scheduled 4 weeks. Moreover, we are fortunate in US. We have to consider this. We have to discuss this, that US planned well to procure the vaccines. So at this point, US is in vaccine excess zone. My folks, my family back in India, they are scrambling to get 1 dose of vaccine.
Right.
Because they are not so fortunate to have vaccines available to them. So in those countries, their government is actually advocating get your second dose after 90 days after the first shot.
Yeah.
So we have to consider, put these facts into perspective that we are really, really lucky, and we can begin a process to eradicate this infection, starting in this valley, starting in US, and slowly spreading, controlling the infection worldwide. Because people from all over the world comes to Las Vegas. And we want that.
Very true. And, as a very international city, and I think it's really important to focus on the fact that we have people like you, Dr. Mandal, representing, minorities like Indian American. We have ACDC. What they're great about is they have bilingual staff, people who are Vietnamese, Chinese, Thai, Filipinos. And I think that's
all across the world.
Right. And we want to make sure we get this, the kind of the trusted source speaking different languages out there, because as you said, Dr. Mandal, there's still that hesitancy, not just from people who are born and raised in this country, immigrants who are still hesitant about getting the vaccine.
That's a very important point. So if one looks into the data, unfortunately, the rate of vaccination or immunization is still lower in the minority community all over the country, including our valley in Clark County.
Right.
There are many reasons for that. Without going back to those reasons, currently, we need to reach out to our minority community any way and every way we can do that to develop their confidence so that they come to the vaccination site, immunization clinic, they roll up their sleeves, I want my shot. That can begin with what ACDC is doing in the Asian community. Same way we want to go back to the other ethnic communities so that they can feel confident and they can voluntarily participate with confidence that these are safe vaccines. This will protect me. This will protect my elderly in my family, my church group, in my friend circle, and young kids who will go back to the school beginning of fall.
And that's a really good point. Now, we're really focusing and at ACDC, our COVID-19 clinic, if you want to put up a graphics again, so it's at Shanghai Plaza. This is right in the heart of the Spring Mountain corridor where you can go right now every Sunday. They're actually closed this coming Sunday because it's the 4th of July, but every other Sunday after that, you can see the address right there, 4276 Spring Mountain Road, Suite 207. Dr. Mandal has been there. We're trying to get kids because, a lot of parents obviously want their kids to go back to school this fall without any concerns and things like that. But talk to me a little bit about that because, there's still hesitancy, with getting kids too. But we're seeing, and I think this is really concerning, I'm seeing stats that younger people are getting ill and dying. And this is not what we usually think of with people who are vulnerable to COVID-19.
Right. On my second screen, I was just looking at the data, Clark County data, which shows that individuals 18 to 24 age group and 25 through 49 age group, they are the highest age group. These are the age group where infections are in the upswing, and they are infected at the highest number compared to the other age group individuals. There are some reasons. Primary reason is that perhaps this is the age group who are socially most active compared to the other age groups, and being in a sort of younger population, such as 18 through 24 or 25 through 49, they perhaps are more bit overconfident that nothing is going to happen to me. So we need to make sure that that's the age group gets the vaccines moving forward. Meaning we need to convince them, yes, you are in good health, in good shape, but we want you to remain free from infection, remain protected. How you can protect yourself?
And the statistics show, the one that you just saw, that, even if you're young, you can still be vulnerable to get COVID-19.
One can still be vulnerable getting COVID because few things. Virus doesn't discriminate between an young individual, adult, or elderly. Yes, there are some little more risk factors associated as one gets older, but anyone can get infected. Second, it does not discriminate between ethnicity, political, religious belief, or anything. Virus is a pathogen. If I get exposed to the pathogen, chances are that I will get infected. If I get infected, I can be miserably sick, ill, and end up in a hospital setup, ICU setup. But we can protect ourselves. We have a very good weapon to fight this war against this virus infection. That weapon is vaccine. That's a shield. That's a shield of protection. It's available to us. It's available freely. There are many incentives, such as enrolling the vaccinated individuals in $1 million lottery. Someone is offering a beer. Someone is offering a free meal. All we need to do, just show up there, roll up our sleeves to get this vaccine protection, which is freely available to us. But you are very right. In this younger age populations, the infection is on the upswing. And there is a reason for that. Most plausible reason is that they are more socially connected. They are more socially active. They are going all around. Thus, they are the most vulnerable, and they are perhaps acquiring more infections compared to the other age groups.
Let me ask you this. We've talked about, now 12 and over can get vaccinated, but kids younger than that still can't. And their parents who are concerned about that, especially kids going back to school. What's the latest research on that? Are we going to see that vaccination soon?
Yes, it will come very soon. I cannot predict, but as much I understand. Sure. To begin that, to address that area, that question, it's a very good question, very good area of discussion, because many households do have kids younger than 12-year-old, and they go to the daycare, they go to the elementary school, they will go to the pre-K, beginning when school opens. What will happen to them if they remain unvaccinated? Good thing is that there's a good news. Good news is that both Moderna and Pfizer entered into those specific, means age-specific vaccine clinical trial protocols for last couple of months, actually. So from 12 to 9, 9 through 6, 6 through 3, and up to 6 months of age group in kids are already being recruited by both Pfizer and Moderna vaccine, the manufacturers, the pharmaceutical company, to do a short, focused clinical trial to understand the vaccine safety and efficacy up to the 6 month of age children. That results will come out very soon. I am hoping by end of July through August, the results will come out. And if the results show promise that they are not only efficacious, but they do not cause any harm, they are safe to be given to these children. Most likely beginning of fall, FDA will approve immunization protocols for the children up to 6 months of age. So there is a hope. There is a great hope. Scientists and clinicians are already working on that aspect because scientists understand, clinicians understand that this virus, once again, this virus does not let one go. If one gets in contact, in touch, it's a respiratory illness. It might as well get inside someone's body as young as 6 months of age. So there is a hope. I'm very hopeful that it will show promise, but we have to patiently wait for the clinical trial results to come up and vetted by the scientists, clinician, and the advisory body that is constituted of individuals all over the country from various walks of life. You'll be surprised. There are ethical persons, bioethicists, there are lawyers, on top of social workers, in addition to clinicians and scientists. Everybody gets together to make a decision whether this vaccine is safe and effective. So I'm very hopeful that information will come out in next couple of months.
And that's great to hear, and as you're saying, more people are coming back to Las Vegas. Now masks are becoming, not required, and there's signs up in places say if you're fully vaccinated, you don't have to wear a mask. Tell me about that, because some people are still concerned and like, well, should I still wear a mask because we're only about 48%? Right. So what's the latest?
It is a bit concerning and it's a bit confusing. Although CDC's guideline was reasonably clear, what they said, Rochelle Walensky, current CDC director, Dr. Walensky, what she said in that TV interview and on CDC website, that if one got both their doses or fully vaccinated, even with single shot J&J vaccine, 15 days after completion of the vaccination, that individual is highly protected. What is the level of protection? About 94% protection with Moderna and Pfizer vaccine, slightly less with J&J vaccine, but really altogether very highly protected. They do not need to wear a mask, wear a mask if they are not congregating with other individuals who are also vaccinated. Idea is that if I'm vaccinated, I will not catch the infection, get the infection, therefore I will not transmit the infection. So when both the individuals or all the participants in a room, they're all vaccinated, there is really no need to wear a mask. But if one doesn't feel that comfortable, that confident, they can always wear a mask. But when one vaccinated individual is going to mix with in close proximity for a long time with another unvaccinated individual, or I simply do not know whether that individual is vaccinated, I still wear a mask when I go to the gym, when I go to Costco, go to Smith's or Sam's Club to do my grocery. I do wear a mask.
You do?
Because I feel that that's an extra safety barrier. It doesn't bother me. I feel good about it. It gives me a second line of protection. Vaccination is the best protection. Along with that, I can improve the protection when simply wearing a mask when I'm in a congested place? Because I simply do not know. I cannot ask anyone because it's personal information whether that individual is vaccinated or not. So what is my best option? My best option is wear a mask when I'm around other people, and I know that will protect me because
and I think that raises the point. And you have been fully vaccinated, and you're
I'm fully vaccinated in January.
But the people who aren't vaccinated, I mean, they're the ones really opening up themselves to the risk of getting.
Yes, and they are the most vulnerable people. They can get themselves highly protected simply wearing a N95 type of mask or KN95 or simply a surgical disposable mask that will cut off that viral transmission up to 70% level between one infected individual and transmission of the viral particles into them. Mask is highly effective in preventing it. It's simply a barrier.
Right.
And still very good approach and option, even with the individuals who are vaccinated, but it's up to them. But that was the guideline, came out from CDC, but there is a way people started misinterpreting the information, and there was a bit of concern and confusion also what it really means. It means that when fully vaccinated, one is protected,
right,
but still they can increase or improve their level of protection, particularly with the emergence of variants, just simply wearing a mask when they are outside amongst other individuals.
That's great advice, and a good reminder that we're still in the midst of this, and we do want to get as many people vaccinated as possible. So let's put that information up one more time. The ACDC's COVID-19 vaccination clinic that has been going for a few months now, still ongoing right now, is every Sunday from 9 a.m. to 3 p.m., except for this coming Sunday because of the 4th of July holiday. Make sure you come and make an appointment if you can. Go to the website there, call that phone number, or they take walk-ins. And reminder again that this is 12 and over. So bring your kids, bring your teenagers to get vaccinated. They're still offering both doses at this location, Shanghai Plaza, operated by ACDC. They have multilingual staff there to help have health experts on hand to answer any questions. Also, if you have not, and again, this is free of charge. And if some people, this should be kind of public information by now, but there's no charge, no cost with getting vaccination for COVID-19 anywhere, not just ACDC. Right. Wherever you go, right, Dr. Mandal, no charge.
Yes. No charge. There is no charge, only information. Anyone will ask you your date of birth because they need to record your name, date of birth, and have you received the vaccines before. That's all. There are no charges, no personal information are required to get a shot.
That's great. All right. Well, that is our show for today. Dr. Mandal, so great information coming from you. We're so thankful to have you here in Southern Nevada, not only teaching our students at Roseman, but also be a source of great information here during these times. So I appreciate you being here with us today. Thank you so much.
Thank you, Petronia. Thank you, Johan. It's my pleasure. Good to work with you always. Thank you. Stay safe. Bye-bye.
Thank you, Dr. Mandal. And thank you for watching this episode of Family in Focus. And we'll be back again next Monday. Have a great day.
Bye-bye. Thank you.